Good evening and welcome to Chicago Tonight. I'm Brandis Friedman.
And I'm Paris Schutz. On the show tonight.
Today does mark our first long-term care facility vaccination.
We learned about the vaccine rollout and more from Dr. Allison Arwetti, Commissioner of the Chicago Department of Public Health.
If we don't qualify, who does?
A year in, people of color say Illinois' legal marijuana program has fallen short of its promises.
For the latest in our Firsthand Gun Violence series, we talked to victim advocate Pastor Donovan Price about helping people through Chicago's violent year.
A Northwestern medicine transplant surgeon on providing care curated specifically for the Latino community.
Honestly, it's been a lot of ups and downs.
A new effort reminds Chicago's theater community that they have mental wellness support even though their stages have gone dark.
Within 2 weeks, everything totally changed.
And looking back at the year in Chicago, reflections on the past 12 months from the WTTW news staff in part 1 of Making Sense of 2020. But first, some of today's top stories. Former First Ward Alderman Proco Joe Moreno faces several charges, including driving under the influence, after a string of car crashes last night in the Gold Coast. Chicago police say the 48-year-old was driving his 2017 Audi A6 around 9:30 last night when he struck at least 8 parked cars on North Astor Street, including the block where Governor J.B. Pritzker lives. None of the damaged cars belong to the governor. Moreno was taken to Northwestern Memorial Hospital in good condition. Now, neither he nor his attorney, 21st Ward Alderman Howard Brookins, could be reached for comment. Moreno is also facing other felony charges in a separate case. There's more of this story on our website. State health officials say another 4,400 people have been diagnosed with the coronavirus in Illinois, and 105 people have died since yesterday. The state's total number of cases is more than 942,000, and 16,074 people have died. We'll have the story of the ongoing vaccine rollout in just a few minutes. The controversial Boeing 737 MAX jet will fly passengers for the first time in nearly 2 years tomorrow with an American Airlines flight from Miami to New York. The planes had been grounded from March 2019 until last month when the Federal Aviation Administration approved the changes that Boeing made to the jets. United and Southwest Airlines still have not added the MAX back to their schedules yet, but United says it plans to do so sometime in the next 3 months. The 737 MAX jets are more fuel efficient than the earlier versions, so airlines have an interest in getting them back in the air at a time when they're hemorrhaging money due to low demand for air travel. Illinois' recreational marijuana program is approaching its first anniversary, but people of color still seem to be locked out of profiting from it. Amanda Venicky joins us now with more. Amanda.
Brandis, there was a lot of excitement when Illinois legalized marijuana by those who wanted to be able to legally smoke and use it, like the folks who almost a year ago lined up outside of Chicago cannabis dispensaries to buy weed, but also among entrepreneurs, particularly people of color, who were promised a leg up in the business. A central tenet of Illinois' law was to promote social equity, while mostly white men owned Illinois' first dispensaries, so those that initially served only medical marijuana patients. In awarding licenses to operate the next round of dispensaries, Illinois was going to prioritize applicants from disadvantaged neighborhoods or those who had suffered directly from the war on drugs. Instead,
I'm trying to keep the language clean, but for lack of a better term, it's a big cluster jug. It's just all messed up.
Mark Pollins is one of the hundreds of those who applied for one of only 75 cannabis dispensary licenses. Portia Mittens is also trying for one. She grew up in Macomb and she now lives near Kankakee, but she did recently spend 4 years running a dispensary in Oregon. She says the application process there was totally different.
I mean, night and day. It's literally a 180. Like Oregon's application was maybe 6 pages. Like, it was like, are you alive? Yes or no? Like, do you breathe? Yes or no?
Whereas Illinois, she says, was like writing a dissertation. Now, Illinois was supposed to have awarded cannabis dispensary licenses in July. Instead, The process is mired in accusations and legal wrangling. No new licenses have been awarded.
And it's just like, if we don't qualify, who does? And that's what was very disheartening to me. Not that I felt like I deserve one because I'm a current owner or because I'm a Black woman, or it was just like, okay, we're extremely qualified in every aspect you could think of. I've successfully ran a business dispensary for 4 years. And if I'm not qualified, who is?
It's not just the licenses for pot shops that are behind. Other licenses are stalled too, like for craft growing cannabis. Ambrose Jackson says that has even bigger negative consequences.
Unease and uncertainty, especially when it comes to our team members and being able to retain talent. But we're also in a position, just like many other applicants, where we're losing our building. Which essentially, means that we're losing upwards of $100,000 to $200,000 of money invested in this process.
Craft grow applicants were to have secured building space before submitting their paperwork. So this delay really has them in limbo, some backing out of plans to buy buildings. And then Jackson says his group stands to lose their lease. He's frustrated by the lack of communication from the state, and also that social equity applicants who the process was supposed to help are now instead in distress.
It's an uphill battle. Number one, it's an uphill battle just to be able to have a seat at the table, which for me and others like me is the most upsetting part of this. We really took J.B. Pritzker at his word, and that the purpose of passing legalization for adult use was meant to help address the harms.
Mittens is more understanding of what she calls growing pains. Still,
we have missed so many opportunities to grow this industry, to educate people, and to assist during a time where people need the most assistance. This could have brought so many jobs.
It's not like demand for marijuana has stalled.
I think what stings the most is when we get these reports about how much money is being made. Well, we're up to close to $1 billion, and none of us have been approved. It's just not fair. I can't even say I'm happy for the people that's making that billion, because that should be us. This bill was sold to us for economic development and social equity in our communities.
Pullen says if he does win a license, he will put a pot shop in Roseland, and then he says he will invest the proceeds to help the community even more. Now, neither the governor's office nor the state agency that is in charge of that pot licensing process responded to requests for comment. So, Brandis, we still don't have a timeline. Back to you.
A lot to keep an eye on, Amanda. Thank you. And now to Paris and a conversation with Chicago's top doctor, Paris.
Thanks, Brandis. 20,000 Chicago residents have so far received the first shot of the coronavirus vaccination. But a look at city data shows that most of those residents live in affluent zip codes of the city, even though the pandemic has had a disproportionate effect on lower income, African American and Hispanic Latino communities. Joining us to talk about vaccine distribution and more is Dr. Allison Arwetti, Commissioner of the Chicago Department of Public Health. Dr. Arwetti, thank you again for being with us.
Thanks for having me.
Okay, so 20,000 folks vaccinated thus far, latest count. Your assessment as to how the rollout has gone so far?
We've been really pleased with how it's gone. Obviously, most of our work to date has been with our hospital partners, and we were one of very few jurisdictions that got vaccine in the first week to every hospital in the jurisdiction. So all 35 of our acute care and specialty care hospitals, big, small, no matter where they were or how much help they needed, we got them all started with vaccine, and we continue to grow that. Obviously, then today, we were able to get started with our outpatient, which is going to be really important, especially as we look to address some of the inequities that we are already starting to see and that we'll be working hard against here in Chicago.
And speaking of those inequities, we mentioned at the very top, let's take a look at the map of where the healthcare workers live who've been vaccinated so far. So as you can see, it's more affluent zip codes. The heavier blue is the higher rates of vaccination, kind of around the River North area, the South Loop area. What accounts for that?
So we've mapped out here in Chicago, not just where healthcare workers live, but where different types of healthcare workers live. And where you're seeing a lot of overlap there, that's where a lot of doctors, nurses, some of our more affluent, as you noted, healthcare workers do tend to live. Where you look at more of the technicians or more of the support staff, healthcare workers, they tend to live in other parts of the city. And we know that one of the strongest predictors of being signing up for a vaccine is level of education. People who have a higher level of education are much more likely to be saying, I want to get the COVID vaccine earlier. And so we're working certainly within the hospitals to make sure, just in the next week or two, they will have received enough vaccine to vaccinate all of their staff. And that means all staff, not just the doctors and the nurses. From the beginning, we've been saying, make sure you're vaccinating anybody who's working in the wards or in the areas that are highest risk for COVID patients. But as we expand out there, we do think that there will be some improvement. And then in our own work, equity is really built into our approaches here. For example, as we move toward outpatient, we're pushing most to some of the clinics in the areas where we're disproportionately seeing a lot of COVID being diagnosed. And we, for example, are starting right out with home healthcare workers, which we know are disproportionately Black and Latinx here in Chicago, less likely to be connected to large systems. So we're pushing against this, but I think we're going to make progress.
And Dr. Arwetti, so you mentioned level of education is a predetermining factor in terms of who might get the vaccine at a higher rate. Are you hearing from hospitals that they're having a harder time convincing some of their medical staff, nurses, support staff to get the vaccine?
Yeah, well, I think it's like any population. You've got to make sure that you're answering the questions, really making a space for people to get the information that they want and they need. Healthcare workers in particular want to see the data, want to really understand that this vaccine is safe and is effective, which it is. And so I think they did see some of their first people wanting to sign up to be vaccinated were some of those perhaps higher paid, more educated healthcare workers, but they're working hard, and we've been asking them to work hard to make sure that they are answering the questions and giving the support so that we can really see healthcare workers across the whole range of healthcare workers get vaccinated.
All right, so you mentioned today you're starting with outpatient vaccinations. The first long-term care facility is receiving vaccinations today. What will the rollout look like for these facilities?
Yeah, absolutely. So today was the first day that we were able to give Moderna vaccine. That's the one that doesn't need to be ultra cold. And so that really expands our ability to push it out farther. So first, we keep going with our hospitals. They keep getting vaccine week after week, but we add on outpatient healthcare providers, meaning clinics, and we're starting with the ones that are doing a lot of COVID diagnosing, that are seeing a lot of COVID patients, and long-term care facilities. We've got 128 skilled nursing facilities and assisted living facilities in Chicago. We started with 8 today, 26 this week. We just keep building from there. Again, wanting to make sure that we are getting vaccine through our pharmacy partners to all of these settings, regardless of where they are in Chicago.
So companies like Walgreens and CVS helping out on that. We've heard these scattered reports around the world of allergic reactions, and very minimal percentage of folks, almost to be kind of a statistical outlier. Have you seen anything like that in Chicago?
So we actually pulled together a group of allergists here in Chicago to really make sure they were advising us on this. What are we seeing? What do we need to advise? What do we need to have in place? We broadly, there have been 20,000 people vaccinated in Chicago. There's been 2.1 million people already vaccinated in the US. And there have been a handful of these allergic reactions, but we see that. We're always prepared, even if we're doing a flu vaccine clinic, we're prepared in case someone does have an allergic reaction. And there's been some work here to make sure that if somebody gets a COVID vaccine, we do monitor them for at least 15 minutes and 30 minutes if there's any prior history of allergies, just to make sure that if somebody were to have an allergic reaction, we absolutely, no matter where you're getting vaccinated, we've got the medications on site to help treat that. But again, it's not happening with great frequency. This is really looking like it looked in the trials.
Got it. All right, Dr. Arwetti, let's move to the case count. I believe the positivity rate in the city right now in terms of testing is about 6.8%. That is the lowest in several weeks. Although, do you fear a spike given the high amounts of folks that traveled and congregated over the Christmas holiday?
Yeah, so there's a few pieces to that. Certainly, we saw a spike over Thanksgiving. We at that point had gotten down. We'd been at 16%, we'd gotten down to 11%, and we saw it come back up to almost 14%. It took us some time to come back down. Where we're sitting now is certainly good progress from there. So the hope is we may not see as big of an increase as we saw over Thanksgiving, given that we are starting to make some good progress on COVID. We're still having more than 1,000 cases a day here. That positivity is still not where we need it to be. So we hope, again, we know a lot of people did alter their holiday plans, and we hope that New Year's also will be more of a time for quiet New Year's with the family, as opposed to some of these large gatherings. We really are making progress here, and we want to be able to move ahead with more of this reopening, potentially, really next month, if we can get our data to a point where that is safer. So we're heading in the right way. We'll know more over the next week or two what kind of bump we may see from the holidays.
So certainly Illinois has been heading in the right direction the last couple of weeks, although President-elect Joe Biden warned that January might be the toughest month in recent American history, with cases across the country going a different direction. Do you see the aggregate cases in the country going up even as Illinois is stabilizing?
Yeah, it's been really interesting how this virus has continued to really hit different parts of the country sort of at different times. Like Southern California, right, which doesn't even have winter weather, is having absolutely one of the worst outbreaks in the whole country right now, really out of hospital beds, at a point that we were not really expecting to see so much in an area that can do a lot out of doors. It just reiterates that it's not enough to just be out of doors. You really need to have the precautions in place. So I think the country as a whole, this is the most cases we've ever had, the most hospitalizations, the most deaths we've ever had. I'm, of course, very pleased that in Chicago and Illinois, we are heading the right way, and most of the Midwest is too, although Indiana is still lagging a bit. And so, the hope here is that the rest of the country will sort of follow along with this. But I'm feeling pretty optimistic about where we are, but I know that there's the potential for it to get pretty bad again if people do let up or think that the vaccine means that they don't need to keep doing the things that we know work.
All right. Dr. Allison Arwetti, we thank you so much for your time, as always.
Thank you.
And Brandis, we go back to you.
Paris, thank you. It's been an extraordinarily violent year in Chicago, which has seen around 750 homicides, according to police. Now, that's 300 more than in 2019. Tonight, as part of WTTW's First-Hand initiative exploring gun violence in Chicago, we once again look at violence in the city, as well as efforts to curb it and heal communities. Mayor Lori Lightfoot and other public officials have partially laid the blame for this year's spike in violence on the pandemic.
The courts have been impacted. The jail has been impacted. Our federal partners were absent for the first 3-4 months of this pandemic. So everything that we depend upon to really build safe and healthy communities has been dramatically impacted by COVID-19.
And joining us now to talk about Chicago's violent year and more is Pastor Donovan Price, a victims advocate who offers support and resources to victims of gun violence and their families, often just minutes after a shooting has taken place. Pastor Price, welcome to Chicago Tonight, and thank you for joining us. So you arrive at shootings often right after they happen. Give us an overview of what you do and see when you arrive.
Generally, I try to arrive approximately 20 minutes after shots fired. When I get there, the ambulance or ambulances are usually, if they're going to rush somebody off, they've done that. But if the person is going to be declared dead on the scene, then they stay there and do paperwork and such. But then the family starts gathering. Soon after that, what I call the grapevine starts happening, and chaos can actually break out. The more people there are shot, whatever the case may be, as well as community members wondering what's going on, etc.
And what do you do when you're there?
I try to help bring a calm to the situation, helping parents or families, these mothers, whatever the case may be, to calm down. And one of the best ways to do that is by providing them with the information they need in terms of the process. Sometimes they're not even 100% sure if the deceased is the person that they're looking for. In most cases it is, but there's a lot of information that they need to find out that will help them along with the process, which is approximately 3 or 4 hours at the crime scene. And the detectives and the police, sometimes there's information that they need as well. And so I help with everyone who needs information, from the community to the police to the family.
Of course, there's information. What are some of the biggest needs of victims and their families that you help them with in those moments and then later on?
Well, immediately they want to know as much as possible about what's happening. What has happened? Is there any information on the shooter? Is there any information on how the person got killed? Why is the person still lying there? Because in a lot of cases, the person has to lay there, the body has to lay there until the initial investigation is done by the detectives and such. They want to know information about that. And then as time moves on, they have their vigils or whatever the case may be, helping them find resources for those, helping them find the things that they need in order to begin to move life in that more abundantly as they move forward from the most tragic incident in their lives.
Now, as we mentioned, Chicago has seen about 300 more homicides this year in 2020 than in 2019. You can see some of those numbers on our screen there. Pastor Price, have you noticed the difference on the ground this year?
Oh, absolutely. This with over 4,000 people being shot, it's obvious that there has been more than in any year since 2016, which is when I began this, that there's definitely a problem. The amount of deaths, the amount of mass shootings on every level, it's definitely been. The amount of children, of course, has been a major issue. It's just it's been very bad this year, very bad.
You just mentioned children. How is your approach different when working with the children who are victims of these shootings and their families?
Well, depending upon if the child has survived or not. If the child has survived, then there's generally a long process for the child to get better physically. Of course, we need some kind of trauma treatment in order to help the child to heal emotionally and otherwise. You notify the Chicago Public School System. They like to do certain things to help as well. Sometimes I even have to go to the school and work with the school as they try to adjust to a child who has been shot, whether they're in 3rd grade or whatever the case may be. And parents living their life after the loss of a child, especially a loss of a child in this type of circumstances, is always a very terrible thing.
We heard the mayor speaking earlier about the impact of the pandemic on shootings. From your perspective, how has the pandemic affected the violence you see in Chicago?
Well, in my humble opinion, I don't really think that the pandemic is the cause of the rise in shootings and the rise in homicides. Perhaps it is one of the many reasons that things are bad, but I wouldn't say it's a major cause. I think the hopelessness and the things that cause shootings and cause people to shoot and that cause hurt people to hurt people and things like that are still in existence and perhaps haven't been addressed in a proper way, and therefore they're growing. But I don't really totally agree with the fact that COVID is a major reason for the increase.
You've been on the scenes of thousands of shootings. What keeps you coming back?
The absolute need for help. There's a place that not a lot of people will go to help people. Not a lot of people that run toward the bullets. Not a lot of people know the process, working with the police or working with the community. And it's kind of a special thing. And I'm thankful to be called to serve in this situation because it's very different, but it's very needed. And as long as I can be there, I will be there.
Now, one shooting alone, witnessing that or the aftermath of that can leave a person traumatized. How do you personally maintain your mental health when dealing with this kind of violence and tragedy?
Well, I simply do the best I can. I'm not currently in any programs and actually am experiencing some PTSD symptoms. But I have my ways of decompressing, whether it might be cartoons or just relaxing or whatever the case may be, soothing music. or just a little time away, which is something I haven't been able to do very much, but I'm trying to work on doing a little more. It's the things that anybody would do who needs to de-stress, except my de-stress may be a little deeper.
So looking ahead to 2021, you're hoping to expand your work. What can you tell us about that?
We want to expand to actually one in office, if that can happen. We're going to start having Zoom grief counseling. We've trained a group of clinical therapists so that they can not only respond to shootings, but they're going to place satellite offices in several areas around the city so that people will have a place to go in their community where they can take care of some of the trauma issues that are going on.
Okay. Pastor Donovan Price, thank you for joining us. Take care of yourself and Happy New Year.
Thank you and God bless.
And now, Paris, we go back to you.
Thank you, Brandis. Theater in Chicago shut down in March and won't be returning anytime soon. A new effort is a reminder of the ongoing support that exists within the theater community. Producer Mark Vitale did a wellness check on some local stage artists who currently cannot play to an audience.
We have to make it safer here for young people. I am working closely with the Chicago...
In March, Chicago Tonight visited a final rehearsal for Her Honor Jane Byrne at Looking Glass Theater. Robert Cornelius was in the cast.
5 performances after we opened, we were closed, and we had been developing it for almost 2 years. So it was a really exciting time, and it just got snatched away from us. So it was a lot of emotional heft to deal with that. And so I decided to explore therapy for the first time, And it's like, it's the best part of my week. It's something that makes me feel better. It's something that just to talk about it out loud and not be the only one. And I think that, especially in the Black community, a lot of men consider therapy a sign of weakness, and rather than, you can deal with it, we have the barber shop and we have the pool halls and we have all that. We don't have all of that now.
Actress and playwright Sandra Delgado is a member of Teatro Vista, and she's been a regular on the stages of Goodman and Steppenwolf theaters. A workshop of her new play was suspended when the pandemic began.
Especially in the beginning, the first few months, you just find yourself questioning all your life choices and wondering what does theater look like in the future? What I love to do the most, how is it going to change, and when is it going to come back?
Delgado is married to the artistic director of Collaboration, a theater dedicated to social change. We visited them in 2018 for Peace Book, a free variety show they staged in a West Side Park District building.
We're all really going through a lot right now, but the theater sector is filled with people who have arranged their whole life around sharing space. And we've lost our livelihood, and we've lost our contact with one another. And the isolation for that kind of person can be very difficult.
Collaboration is now working with Season of Concern, the League of Chicago Theaters, and the National Alliance on Mental Illness.
I heard you had virtual support groups.
A new outreach campaign aims to spread the word in the theater community that mental wellness and even financial assistance is sometimes just a phone call away.
We're calling it call time. It's about, one, reaching out and calling someone that you've been thinking about, just to check up on them.
I was concerned about being left by my mom alone and not really having connections. But to be able to talk about just like things that got me here has been a really big help.
Just pick up the phone, call each other. You might think you're helping somebody else out, but you might be actually helping yourself out in return.
I've had a lot of ups and downs, and I know that I'm not alone. And so with Season of Concern, we actually have funds to help theater artists make up the cost of therapy if that's something that they need.
It's a time when it's important for us to make sure that we are working together to lift each other up, just everyone. I mean, I feel like across boundaries, and if you open your hearts a little bit, and people can be more compassionate.
For Chicago Tonight, this is Mark Vitale.
Find out more about call time and other resources for Chicago theater artists on our website. And we're back with more right after this.
We can get past the idea of turning this into a political topic and really get to serving our communities. That's something I can get behind.
Maybe we can use this as a calling card to unite.
Still to come on Chicago Tonight, digging into the racial disparities that exist within the organ donor and transplant system. And we'll look back at the year in Chicago with part 1 of Making Sense of 2020. But first, some more of today's top stories. An attorney for a U.S. Special Forces sergeant arrested in that deadly shooting at a bowling alley in Rockford says her client may suffer from post-traumatic stress disorder. Additionally, a Winnebago County judge denied bail for 37-year-old Duke Webb, who was arrested immediately after the shooting, which killed 3 men ages 69 to 73 and injured 3 others, including 2 teenagers. Webb's attorney told the court today that Webb appears to have issues with memory loss and that he will undergo mental health evaluations. Webb joined the Army in 2008 and has been deployed multiple times, including to Afghanistan, earning 2 Bronze Stars and other awards. His arraignment is set for February 16th. Former First Ward Alderman Joe Moreno is facing more charges, this time for driving under the influence and several misdemeanors. They all stem from a string of car crashes in the Gold Coast neighborhood last night when Moreno allegedly drove his A6 into at least 8 other parked cars along North Astor Street, including the block where Governor J.B. Pritzker lives. Moreno was taken to Northwestern Hospital in good condition and hasn't been reachable for comment. He's also awaiting trial on felony charges of obstruction of justice and insurance fraud in a separate case. You can read more about both of those cases on our website. And state health officials say another 4,400 people have been diagnosed with the coronavirus and 105 people have died since yesterday. The state's total number of cases is more than 942,000 and 16,074 people have died. Now to WTTW News Director and host of Chicago Tonight Latino Voices, Hugo Balta, and ways to ensure equitable access to a life-saving medical procedure. Hugo.
Thanks, Brandis. Success rates for organ transplantation have grown through the years, but disparities impacting communities of color remain. Studies show Latino and Black patients are not only disproportionately impacted by diabetes and kidney failure, but also wait longer for organ transplants compared to white patients. Some Latino patients also face significant language barriers through this critical process, which is one of the reasons why our next guest founded the Hispanic transplant program at Northwestern Medicine in 2006. Joining us now is Dr. Juan Carlos Caicedo, transplant surgeon at Northwestern Medicine and the founder and director of the hospital's Hispanic transplant program. Dr. Caicedo, welcome to the program. Tell us, what prompted you to start the Hispanic transplant program and what distinguishes it from the other transplant programs?
Great. Thank you very much, Hugo, for inviting me today. Then basically in 2006, we started the first Hispanic transplant program in the nation. There was no other programs targeting Hispanics or helping Hispanics. That was the first thing. You know, Hispanics are the largest minority in U.S. today, and they have the fastest growth, and nobody was serving this community. And that is why we started in 2006. Now we have the largest kidney transplant program in the nation. We have 50 people working with me that are serving this community. And that is what makes us different. We were the first one. Now we have the largest team serving this community to be able to do it in their own language, knowing their culture, because our team is bilingual and bicultural. And removing all the language barriers and cultural barriers, we have been able to engage them in a positive way. We have transformed the way that they are thinking, they're looking kidney transplantation, organ transplantation, also, for example, liver transplantation. And we have been able to increase organ donation in this community. We have improved the access to transplant care,
Dr.
and
Caicedo,
that's what we do, more transplants in this community.
Let's talk a little bit more about some of those barriers. There are disparities within the organ transplant system. According to the Department of Health and Human Services, in 2019, the number of organ transplants performed on Hispanics was about 29% of the number of Hispanics currently waiting for a transplant. The number of transplants performed on white Americans was 47.6% of the number currently waiting. Dr. Caicedo, why are Hispanic people in some cases more likely to wait longer and have a higher mortality rate than other groups?
Right, you're absolutely right in all of these statistics and points. Then the issue is, even though minorities are the majorities on the waiting list, and from them Hispanics are the largest minority, they have poor access to transplant care. Why? Because institution hasn't developed programs that facilitate the process for them to navigate the system to be able to get the services. And that is what we're trying to do. First of all, improve access to transplant care. And as soon as they arrive to the transplant centers, the other thing that is important, understanding the culture. Hispanic, they have big families. That is a huge advantage because they can have more potential living donors. And if you educate and if you remove these myths or misconceptions about organ donation as well about organ transplantation, they move forward, and that's why we have increased. You were saying in the nation is maybe only 29%. I can tell you in my hospital, there's years where 80% of Hispanics are receiving a living donor kidney transplant. Average has been 63, 65%, even above whites. And that is the big difference in our program also, that we have been able to change the dynamics where whites were donated more. Now Hispanics have had the highest living donation compared with whites, Asians.
Dr. Caicedo, let's talk a little bit more about donations. I'm a donor. My wife is a liver transplant recipient. She actually got the operation at Pablo Tobón Uribe in Medellin, Colombia, where she's from. A 20-year study from 1988 to 2008 found Hispanic Americans are less likely to donate their organs compared to other groups. Can you tell us a little bit about that disparity?
Right. Then there's two things that we need to mention or clarify. There's, you can donate organs after you die, or you can do it while you're alive. Then let's talk about disease donation. Many times Hispanics don't want to donate organs because they believe that if they donate the organs when when they die, or if they sign for example, the license driver license, if they sign it to become a donor, they're not going to take care of them when they arrive to the ER. That is not true. Always physicians are going to take care of the patient. They're going to try to save their lives. That's the first myth about disease donation. Everybody's going to be saved. It can be saved. But if somebody dies, God knows that the organs are needed here on earth. No, with that patient. That is after disease donation. For living donation, many times people are thinking if they donate organs, they're not going to be able to have babies. That is not true. Or if they're going to have sexual performance issues, that is not true. Or they're going to be able to work, exercise, or they have to take medication forever. None of these are true.
Dr. Caicedo, one last question with the time we have left. One of the conversations my wife and I are having is about the vaccination for COVID-19. She is on a shorter list in comparison to a person like myself in regards to getting immunization. People who are organ recipients, any advice in regards to when they should be getting the vaccine?
Right. They have a high priority, or they are in a higher tier to get a vaccine. They should receive it because this is not a live vaccine. And then this is safe for people to receive it, and they can have a big benefit receiving the vaccine compared if they don't receive it. That will decrease the chance of developing COVID, and if they develop COVID, they're going to have less severe forms of COVID. And it's a very effective vaccine, more than 95% efficacy compared to flu that is sometimes 40 to 60%, depends on the year. Then this is a very, it's a great vaccine. Excellent. And then all the population should be encouraged to receive the vaccine.
Dr. Juan Carlos Caicedo, thank you so much for your time and for your insights.
Thank you very much for having me.
Up next, a look back at an unprecedented 2020. But first, a check of the weather.
2020 has been a year like no other. Earlier this month, WTTW premiered the documentary looking at the people and events that made this year remarkable in so many ways. It also took you inside our newsroom to see just how we delivered the stories that were so vital to our area's diverse communities. Here's part one of Making Sense of 2020.
2020 has been a hellacious year.
All our residents will be subject to a stay-at-home order.
One jaw-dropping moment after another.
That other pandemic that we're far too familiar with in America.
Collectively, how many more hits can we take?
The best is yet to come.
And it ain't over till every vote is counted.
This year's really been drinking from a fire hose.
This is far from over.
It's going to take years to really understand 2020.
Good evening. Welcome to Chicago Tonight. I'm Paris Schutz. Coming up on the program, there's a timeout on the field. We meet the longtime Bears.
January 2020. It was a different world.
We're 2 days into the new decade and 2 days into recreational marijuana being legal.
It was
in Illinois.
quote-unquote normal. God, what happened in January?
In Paris, Chicago police are investigating a police-involved shooting this evening in the Belmont-Cragen neighborhood. There's pre-COVID and there's post-COVID, and everything pre-COVID is a blur.
At the beginning of 2020, we were thinking about an election year. Right then, the president was being impeached.
Congress returned from recess today and immediately resumed the fight over the impeachment trial of the president.
And now I don't even know if that cracks a lot of people's lists for the top 5 things that have happened in 2020.
There were all kinds of big news stories happening already.
Former Governor Rod Blagojevich got released from prison, and a lot of people don't even remember that.
We have commuted the sentence of Rod Blagojevich. He served 8 years in jail.
I remember COVID being in the distance. And when I say the distance, I mean at the time it was in China, and then it was in Italy.
The first time we covered COVID, it was, there's like a single case. It was at a suburban hospital.
It was January 24th, 2020. A woman in her 60s who had returned from Wuhan, China, where the virus actually originated.
How concerned should people in Illinois be about the coronavirus?
Overall, I would like people to know in the state of Illinois that the overall risk is low to the people of Illinois.
The CDC was having media briefings talking about, in general, this is what's going on overseas. Then all of a sudden it became Seattle, and then all of a sudden it became Chicago.
It's very likely to become a pandemic, however, because it's growing exponentially.
It's kind of like watching, not a train wreck, but sort of a slow kind of, you kind of watch it happen in slow motion.
It was mid-March. We saw the cases rising.
I started washing my hands a lot more after I got off the train.
Is the mayor going to close down schools? Is, the governor going to close down schools? Going to a nearby school to interview parents about what would this mean for you for a full 2 weeks without school.
The kids by themselves, we got to get a babysitter and everything else, so.
I think it's a little premature.
Let me be clear, I understand the gravity of this action.
This is a nightmare.
Nobody's wearing a mask, obviously, because we weren't there yet.
Pretty much within 2 weeks, everything totally changed.
Starting tomorrow evening, Saturday, March 21st at 5 p.m. until the end of April 7th.
We saw the governor institute the stay-at-home order.
To a stay-at-home order.
Which was just kind of shocking to everybody.
And here at Chicago Tonight, we had to distance as well.
How are we going to do this? How am I going to keep the team safe while covering this story?
All the producers and some of our talent were working from home or from the field.
And then we decided, well, Paris and Brandis need to be separated.
We didn't want, one of them to get it and then, both of them suddenly have it.
And then we don't have a host for the show.
I was so nervous coming into here.
Good evening and welcome to Chicago Tonight. I'm Brandis Friedman.
Our bosses came up with the novel concept of anchoring the show from a different neighborhood every night.
Representative Ma, we wanted to talk about sort of the cultural impact, especially since the president started using the phrase Chinese virus. And I have to say, off the top here, we just a few minutes ago witnessed a very vicious racial tirade.
It has caused a lot of people to be fearful, and it's just highly offensive, it's racist, it's wrong.
In order to fulfill our journalistic responsibility, we need to be in the community and afford them the platform to speak to their truth,
to what they're experiencing.
Showing the real effect of this on real people in all different parts of the city and suburbs.
Tonight, he's in the Little Village neighborhood on the city's southwest side. It's predominantly Mexican-American and home to a large population of undocumented immigrants.
And the other challenge in this community, undocumented immigrants, if they do show symptoms of COVID-19, many are afraid to leave their home. They're afraid to go to doctors or medical establishments for fear of their immigration status being outed.
Where can I go? Who is going to service me? And so it's like, Esperanza Health Clinic. Families are referred to there. The county families are always referred to. So it's like, no, definitely, families are scared, don't know where to go, and then don't know who's actually going to service them, even if you go somewhere.
For the past 2 weeks, Paris Schutz has gotten a view on the ground from various Chicago neighborhoods and suburbs.
And that turned into 3.5 months of going to over 40 Chicago neighborhoods.
From the uptown neighborhood,
suburbs, 5 states.
It became a way to have Chicago be the show.
So we just heard the number, 72% of COVID-related deaths have been in the African-American community. Why such a disproportionate number?
It's something that's existed in the community for a long, long time, and that is health disparities around chronic conditions that people in the African-American community experience.
The big stories of the early days of COVID was the disparity.
We tend to be a fairly hyper-segregated city. We've seen more cases, unfortunately, of people passing away from COVID-19 in our South Side communities with a cluster in South Shore, some cases in Auburn, Gresham.
We gleaned that before the official data had been reported, just anecdotally.
In Chatham, a restaurant that at the very beginning decided that they were going to start delivering free meals to seniors all over the South Side. And this restaurant, mind you, is not exactly raking in the dough.
She had me just dropping food off to them and with no charge.
So that program grew to a delivery of 3,500 meals over the last 2 weeks with a staff of 20 people putting in hundreds of hours.
Mother Wade, being who she is, she reached out to a nice young man from Chicago, and he made a nice contribution to help her broaden her reach as far as getting meals out to the seniors here on the South Side in particular.
That nice young man from Chicago, none other than Kanye West.
Paris, it sounds like Mother Wade has her ways.
It's so interesting to go into neighborhoods that the news media really only focuses on when there are bad things, when there's crime, when there's gun violence. We went into these neighborhoods and we saw a completely different story.
We went to Pullman and Roseland. The story there was the Roseland Community Hospital. We did an interview outside the Pullman Monument with the CEO of Roseland Hospital, who was really, really amped up.
Tim Egan, thanks for being here.
Thank you for allowing me to be here.
So recently, the state got a distribution of the drug remdesivir, about 140 cases of it. It could be a lifesaver for a lot of folks experiencing extreme symptoms. Roseland didn't get any. How come?
Remdesivir is here in Illinois, but it's nowhere near the new Roseland Community Hospital. I guess we didn't qualify. And I just I can't understand why that is. We have the sickest of the sick, and we have people dying. We have a 37% morbidity rate for those inpatients who are admitted for COVID-19.
So you really made the case that this was unjust, and it's playing out before our very eyes.
The disparity here is unquestionable. African Americans are dying at an alarming rate. We're 7% of the population and 16% of the deaths here in Chicago. Remdesivir should be here at Roseland Community Hospital.
We were able to showcase that immediately, raw. It was super raw.
Having Paris out in the field every day gave our viewers the essence of what public media is, which is enriching lives, engaging communities, and inspiring exploration. And that's our motto.
We not only were telling the stories of the residents of those particular neighborhoods and business owners and community leaders, but effectively building bridges between communities that are not only separated geographically, but separated by the disparities to access to healthcare and education and wealth.
Joining us are Charlotte Meunier, a senior at Jones College Prep in the West Loop, Anthony Sanchez, a junior at Morton West High School in Berwyn, Jesus Hidalgo, a senior at Mansueto High School, a charter school in the Brighton Park neighborhood.
People on the north side saw what was happening on the south side. People on the west side were seeing what was happening, elsewhere in the city.
Even though there's still underlying issues that are going on with coronavirus, I feel like my community is one of the hardest hit communities too with gun violence. Recently, we've had people getting shot, and normally I wouldn't hear it where I live, but it's been coming down over here, and I feel like the city hasn't been giving too much attention to it either, because there's still kids dying on the streets that don't have a home, they don't have a safe home to stay at, they don't have a place that they could be with family. All they live is in the streets.
When Governor J.B. Pritzker started doing his daily press conferences on the coronavirus,
thank you for joining us.
We began live streaming them on our website. And this was really like something that we did as a public service to give people access to that source material.
I want to begin tonight by announcing new guidance.
He didn't stop on Fridays and start up again on Mondays. We followed suit. So we actually started working on Saturday and Sunday.
People watched, people tuned in, they cared. We live tweeted. We were having an opportunity every day to ask questions of the leader of our state.
Months ago, we began protecting millions of Illinoisans from financial ruin by banning residential evictions, placing a moratorium on utility shutoffs.
And this was an instance where I think the public very quickly saw, oh, wait, what happens at the state level really does impact me.
One of the most essential mitigations we have for keeping people safe during this pandemic are face coverings. I'm proud to announce today that the Illinois Emergency Management Agency plans to provide cloth masks to every student, teacher, and staff member in
It's
every
not
public
just
school
Chicago,
district in Illinois.
it's all of us.
There's a story we covered about a couple
The whole thing started when I was listening to a piece on Chicago Tonight.
who saw a report about a young person who was making face shields with his home printer.
Richie's idea was to use his 3D printer.
And they were inspired by that story, and they galvanized their community in mass producing face shields for first responders.
Rob dubbed them the Noble Army. After they delivered that first order, they easily found other institutions that needed face shields. Soon, there were 40 people cranking out more than 200 face shield frames a day. The Noble Army has delivered nearly 8,000 face shields for free.
And that, I felt, was so telling.
Like everybody else out there, we had to adapt.
Jews have been celebrating Passover since 1300 BC, but have never done so on Zoom. How are you going to do it this time?
You know, we're not celebrating Passover in the same way that they did in 1300 BCE.
How we adapt as a city, as a society, is part of the story.
The most important thing is we'll connect, we'll remember the holiday, and we will say, here we are next year in freedom.
Our guests were so thoughtful. They have families of their own. They have congregations that they are also caring for. And I think Carol really felt that.
And so we will lend Jesus all of our tables, and we will still celebrate that unity when we start joining together tomorrow evening.
Both of those answers are truly lovely.
Chicago Tonight gives you not only the analysis, but the depth and the history and connections that we have time to talk about.
I think it was also uplifting to hear how, people are adapting and surviving now.
Then slowly you saw people get creative. They realized this is a sense of relief that people still need despite the pandemic.
Music has always been a source of comfort for 18-year-old Cameron Chu. When the coronavirus forced a stay-at-home order, he and a classmate, Brandon Chang, decided to create a project that could bring everyone together.
We want people to look to the arts as something that's healing, something that binds us together. Then we thought that really what would make this more meaningful if this was a global effort and something that really encompassed everybody, because this pandemic is affecting everybody.
Together, they reached out to their network of friends who share a passion for music and coordinated a group medley of The Swan.
The beauty of our show is it's not just doom and gloom all the time. It brings a lot of hope to what's going on.
And tomorrow night, we'll have part 2 of Making Sense of 2020, and you can show your appreciation for the work we do by visiting WTTW.com/makingsense and supporting the WTTW Fund for Independent News. And that's our show for this Monday night. Don't forget to stay connected with us by signing up for our daily briefing, and you can get Chicago Tonight streamed on Facebook, YouTube, and our website, WTTW.com/news. You can also get the show via podcast and the PBS video app. And please join us tomorrow night live at 7. The latest on the threat of domestic terrorism after the Christmas Day bombing in Nashville.
And a local researcher is selected by NASA to explore the outer reaches of our atmosphere. And join me in just a few minutes for Black Voices December Community Conversation. I'll be joined by Chicago religious leaders to discuss the significance of Watch Night and New Year's Day celebrations in the Black community. You can visit WTTW.com/events to join. Now, for all of us here at Chicago Tonight, I'm Brandis Friedman.
And I'm Paris Schutz. Thank you so much for watching. Stay healthy and safe. Good night.
Closed captioning for this program is made possible by Robert A. Clifford and Clifford Law Offices, pleased to give back to the community through numerous charitable initiatives.